Good morning.
Good morning.
Good afternoon. Depends on when they see
Yeah,
this.
so it depends on when you're watching it. Hey, this is February, and we are coming to you live this month with our South Carolina Community Health Workers
B
newsletter.
news. B
B
news.
News.
Yeah. So this innovative lady decided to let's do something that's innovative. We're gonna do the news. We're gonna do it live, which is what we're doing now. And so because we know some people don't have a lot of time to read, so we're gonna give you snippets. But then when you get some time, we want you to go to the written newsletter and just click on the links and you can get more information. So this time, February, of course, is
Wait, who are
History-
you?
Oh,
You got to
I'm Benita Clemens, and I have been a community health worker since I was 6 years old. Meaning I was a trusted member of my little tribe, the little kids, and I helped them whenever something was going on. I helped them to navigate the neighborhood, the system of the neighborhood.
I can only
I was in charge
imagine.
of the first aid kit. So yes, I've been a community health
I
worker.
can only imagine. She probably had somebody follow up to herself. I'm Donna Mack, and I assist Benita Clemens, and I've been a community health worker since I was six. And I was the one up in the tree who needed some help.
You needed me?
Emergency, yes. So I'm a tomboy too, so that was trouble. So anyway, this month we have a lot of great news to share with you.
Yes.
So we're going to give you some stuff around the state. We're going to give you some national news.
Yes.
We're going to get Benita's little newsletter, which has a very historical. We know this is Black History Month, so there's some historical aspects that she'll share. And there's also a historical CHW we want to share with you. So let's go ahead and get started, because that's not all.
Okay, so again, we're going to start with the Black History Note. And we're going to observe this in the name of love, because this is also the month of love. So our word for this month is gratitude, and we're thankful for all of the community health workers locally, statewide, and nationally. So first of all, I want to say thank you for all of your hard work and your service to the community and to making this country better. February 27th of this month, my grandmother will be 94 years old. When she had her first child, it was in a segregated hospital in South Carolina. And I've had some conversations with her about the care and what it was. And at the time, they only had white nurses. There were no black nurses. Black nurses were not allowed to be in that hospital in Anderson. So she said all of the nurses were white, but they were segregated. They had the black women come through a certain door. So she said, but the nurses were all nice to her. And all of the black women had their babies delivered by one special doctor. When she got home, it was community health workers, along with her mother, that assisted her with caring for this child. And of course, she went on to have 16 more children. 17 more. Wait a minute, she has a lot of children. 17, 18, I keep forgetting. I think it's 16,
That's a lot of
18,
children.
18. So, she became a community health worker herself, and she assisted with mothers and helping them to care for their babies. And to this day, she believes in it the old-fashioned way. When you have your baby, you go home, you sit down for 4 weeks, but we know mothers don't do that. So our mothers sneak out the house, but if she catches you before 4 weeks, it's on. And so let's fast forward. So that's our history, with community health workers helping. So fast forward to now, one of our very own, Ramon Stevens, she and I have had conversations about how she assists and educate mothers to help their lives, to be better and smooth in transition. So we've had community health workers since the beginning of time, and Donna's going to talk a little bit about that. But first,
Wait. Before you move on, please share. And Yay, Romaine, and everyone else is doing that great work out there helping mothers
Yes.
in all the capacities that you are doing.
We
that,
got Birth Matters that's in Spartanburg. We got CHWs there.
We have a number of doulas out there who are working to
yes.
help make sure that
Thank you.
mothers actually can safely deliver those babies and stay healthy. Very important. But who is your grandmother? What is her name?
My grandmother's name, oh yeah. I call her grandma, so I think everybody else call her grandma. So she is America's grandma. Her name is Hattie Estella Williams. Most people call her Estelle or Estella, but Hattie Estella Williams. And again, she will be 94 February 27th of this month.
Send her our love. Happy birthday. We love her, and she's a role model.
And she is still she's a community health worker. I'm telling you, she still works for Meals on Wheels.
Oh my goodness.
And if you need like rides to the polls, I don't ride with her, but she's still driving.
And isn't she the lady that's out there crosswalking?
Does crossing guard, 4-lane highway.
You need to stop. All right. So thank you so much for that, Vanita. So we actually have some national news this week as some state news. I wanted to hit that first.
Yeah, let's have some state news.
State
news.
What's going on?
Sisters of Charity, they've done their report on poverty. And this report talks about the innovative ways that community health workers are addressing the health issues in this state in the rural and underserved communities. Also, Voorhees College, one of South Carolina's HBCUs, will be offering community health worker classes to their student population. This is done by our partner in progress, the Center for Community Health Alignment. So those classes are going to be coming soon. So just keep checking in with us about that.
Yeah, this is exciting. I'm excited about the Center for Community Health Alignment.
They are rocking it.
Working with Voorhees.
They work.
Talk about innovative.
Talking about getting this community aligned.
Yes.
Thank you for all the hard work over there.
Yes. And so also we'll go on to the national news.
You want to do national news now? Okay.
Well, no, let's go ahead and talk about a historical character, a historical person that did some awesome work for community health. Well, maybe he wasn't a community health worker. You know how we have different names. In this role that he was back in 1716, he was known as an enslaved person. Onesimus was actually purchased by a Puritan minister's congregation for him. His name was Cotton Mathers. And this was during the time up in Boston when they had a huge outbreak, a pandemic of smallpox. Sounds familiar? Yep. Sounds similar to what we're having today.
Yeah.
Well, Onesimus, Mathers, shall I say, he was wondering why in the world did a lot of these enslaved people not be impacted as much by smallpox. So he asked Onesimus, let me help say that right, Onesimus, about what was going on. And Onesimus shared with him, like so many community health workers do, even though he was in a position that he was not comfortable in, obviously, but he shared with him that what they did was have a operation where they had a wound and took the pus from someone who had smallpox and put it in the wound. And that inoculated them from ever getting smallpox again. Now, of course, back then that was Mathers thought, oh wow, this is it. Because this was killing hundreds of people in Boston. And he was excited about having a cure. But because of it coming from Onesimus, which was an enslaved person from West Africa, the community wasn't ready to receive it. And they didn't want to take in that information, that knowledge. And it took a couple of years and hundreds of deaths later for them to be able to convince the community that this actually worked. Did you know that this actually was what led to the eradication of smallpox worldwide. That information, they used it to create the smallpox vaccine that we had today, or in 1967, I believe. Somewhere in the 60s or 70s was the last of smallpox. Awesome, right? So thanks to Witness Miss, y'all can hear more or learn more about it. Just click below.
Yes, click the link. All right, now to our national news. The National Association of Community Health Workers, which we call NACHWA. NACHWA is busy making an impact with our CHWs, and they're currently working with the Morehouse School of Medicine and the Center for Disease Control, among other national organizations, to make sure that CHWs are empowered with a voice on how this virus can be handled in the communities that we serve. So I'm telling you, NACHWA, our sister Denise Smith, she is doing it.
She is on it. She is on it. I was on a call, and I think Tashina was on a call on Friday, where they talked about a number of items that they want to bring to legislators regarding CHWs, regarding our roles, regarding us being compensated through many different avenues, including Medicare, Medicaid. So this is good stuff, and I so appreciate each one of you that join in on these calls and take a part and let your voices be heard, because collectively we can move this needle and get the recognition, the value that we deserve.
And speaking of that, we're going to talk about our call to action. Community health workers, we've laid the foundation. Everybody,
your voice heard.
We have already laid this amazing foundation for the association, and now we're picking up more steam to get even more organized, strategizing more. So we're going to be calling on all of you to call your local elected officials and statewide elected officials and know who we are. Hello, my name is Benita Clemens. I'm a CHW. I am essential. I need your support. It's going to be
hello. I'm Dynamite. I'm a CHW. I am essential, and I'm one of your constituents. So listen.
Yes. So we're going to have coming up. We're going to be hosting two classes that's going to show us really how to strategize and organize, thanks to a group, More Justice.
Yes.
So we're going to be working with them again. We're going to have two classes, and we hope that you would get on so we could talk about how we're going to strategize to contact our local, I keep saying local, our statewide, our elected officials.
Yeah, even local.
Yeah, you can do local too. So, the strategy is the strategy, but the goal is to create one loud voice so that when we speak, they know that it's us. That's the community health work.
That's it.
It's giving what they need. It's giving what they ask for, because we are essential.
Trust me, these workshops, you're not going to want to miss it, because it will not only benefit you, the CHWs around the state, but it will benefit you personally as far as how to advocate and make sure your voice is heard.
Yes. One voice, one sound. We are one. So do we have any reminders we want to remind them about?
There are.
So we're going to have the classes.
We're going to have the classes, and we definitely want you to, if you haven't already, please make sure you join the South Carolina Community Health Workers Association. We're so appreciative of those who have joined, our members and our advocates, over 100 strong that are CHW identified, but we have over 300 people that connect with us. So we are so appreciative of that. And also join the national as well.
Yes.
Many of you may not know this, but we are like number 4, the 4th largest state at the national level. We have someone on the board, maybe 2 people on the board.
Yeah, we do.
One of our board members, I know,
Julie Smithwood and Lily
Fox are both. Yes. So this is exciting news. You guys are in the number with some outstanding CHWs. Yes. We are recognized statewide. We get calls all the time from other states asking how to have an association as strong as your association.
Yes.
So we are more than happy to represent, and we are happy to have you guys as well.
Yeah. And then you said we're 4th?
Yeah, we have the
In terms
fourth
of
largest
membership?
participation membership.
Okay, fourth largest. Y'all know what I like, right? I like to be number one. Of course, I will remind you, I am the oldest child. That means number one. I am the oldest grandchild of 70, 80 something. Who knows?
Oh my.
Number one. So they call me number one.
It's nice.
I love
It's nice to
being
be
number one. So South Carolina, let's become members of the South Carolina Community Health Worker Association and the National Association. So let's just have, as much power behind our voice as possible. And the membership helps us to have that power.
Indeed. So you guys click below any of those stories you want more information on. Click below, you'll see it. And also look forward to you guys joining us next month. Another exciting show. We'll have some interviews in this as well.
Yes.
And you guys tell us what you want to see, okay?
And also, we want to hear your stories. Please tell us the stories. Yes, like she said, you can come on and tell your story if you don't want to write it. Maybe we'll get more stories from that.
Yes.
If you can tell it instead of write it. Because sometimes people don't have time to sit down and write. So please give us your stories. We would love for you to come on. And self-care. Don't forget about self-care.
Do not forget about taking care of yourself.
Because we have a lot of work. I know we are doing a lot of work during this time of the pandemic. So remember, care for self. And thank you for joining us for our first episode of South Carolina Community Health Worker The News, and goodbye. We love you. Take care, okay? Bye now.